I'm screening hip and pelvis, and note that she has adequate force transmission through sacrum, mid-sacrum, upper sacrum, lumbar spine. I can induce a anterior or rotational force transmission through the ilia. I can take up the slack and spring inferiorly, but there isn't recoil. And in fact, there's a limited amount of this spring mobility after I take up the slack. I'm drawn to the pelvis because her sacrotuberous ligaments are rock hard. And that typically fits a pattern on both sides in which sacrum is wedged posteriorly. There's a complete lack of motion, but she has some motion through the pelvis. This feels like a bone. There's no bone here. Okay, it won't indent. And if I come underneath, you see that slack taken up in her body, but it takes up so quickly, and now I'm using more than the typical force, and there's no force transmission. So interestingly, her pelvis acts like what we call a downslip of the ilium, but on both sides. So I'm curious as to what could possibly provoke such peculiar dynamics, because I don't have a memory of seeing someone with this. Do you recall a fall, a trauma, and your birth history, large child or difficult birth?
My first one was large.
How large?
His head was really large.
I was going to joke and say that. I was just going to jokingly say, did they measure the circumference of his head?
Yeah, his head circumference was actually normal, but he had a very broad face.
Okay.
Instead of it being like a complete circle.
Yeah.
He had a very broad face, and he got stuck in my pelvis. They didn't have to use forceps, but I was about to go to C-section before, because I pushed for 4 hours because I couldn't get him out.
Right.
Mm-hmm.
Okay. So I think that might be explanatory.
Okay.
Anyway, the question is, can I do the usual mobilization, which takes time? It's based on time. It's not 10 reps of this or hold this 10 seconds times 3. It's not that traditional approach. It is gentle but more force for a prolonged time, as in 5 minutes each side.
Okay.
So we're going to see if we can induce mobility through that structure such that that alters the tone in those ligaments. And all things are possible. And we were talking about, I was asking the question, well, what can facilitate so-called increased tone in the ITB?
Mm-hmm.
Well, increased tone in the gluteus maximus, most certainly would. Increased tone in the gluteus medius, gluteus minimus, tensor fascia lata, and more than that, because there are transverse fibers coming off the epimysium of muscle and such.
Right.
So something's increasing the tone in the ITB. It's not that your ITB per se is tight and you can't stretch an ITB. You can't release it. You can change muscular influences on it.
Right.
So that's what took us to this discovery, and I'll stop filming. See you in 10 minutes.